Is wait and see risky for cervical precancer? The wait and see approach, also known as active surveillance, is a strategy used for managing cervical precancerous lesions, particularly cervical intraepithelial neoplasia grade 2 or CIN 2. This method has both potential risks and benefits, and its effectiveness can depend on various factors like the severity of the lesion, the age of the patient, and how well they can stick to follow-up appointments. CIN 2 lesions are changes in cervical cells that can lead to invasive cervical cancer. Interestingly, about half of CIN 2 cases may regress on their own within 2 years without any treatment. Because of this possibility, some healthcare providers suggest active surveillance, especially for younger women or those who are planning to become pregnant. This helps avoid overtreatment, which can lead to complications such as cervical incompetence and preterm birth. However, recent studies indicate that women with CIN 2 who choose active surveillance instead of immediate treatment have a nearly 4-fold increased risk of developing cervical cancer over a 20-year period. This suggests that while many lesions do regress, a significant number may progress if left untreated. Therefore, the wait and see strategy can be risky if not managed carefully with regular monitoring. There are several risks to consider. First, immediate treatments like excisional procedures can cause short-term issues such as bleeding, pain, and infection. Long-term risks may include cervical incompetence and preterm labor, which are particularly important for women who want to have children in the future. On the other hand, the risks associated with surveillance include the possibility that precancerous lesions might progress to invasive cancer if monitoring is not done properly or if the lesion does not regress. Additionally, both approaches can lead to anxiety. Surveillance can create uncertainty, while treatment can bring concerns about procedural risks. Current clinical guidelines often recommend active surveillance for CIN 2 in younger women who are likely to keep up with follow-up appointments. Immediate treatment is usually reserved for CIN 3 lesions or persistent CIN 2 cases. This balanced approach aims to minimize overtreatment while still preventing the progression to cancer. In summary, the wait and see approach for cervical precancer can be a safe option under strict medical supervision and regular follow-ups, especially for younger women or those wishing to preserve their fertility. However, it does carry a measurable risk of progression to cervical cancer if lesions do not regress or if monitoring is insufficient. Therefore, it is crucial to seek personalized medical advice and adhere to surveillance protocols to manage cervical precancer safely with a wait and see strategy.